Namaste betiya, हमेशा खुश रहो betiya. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series of lectures, we are discussing about the various diseases of the hepatobiliary system. In the last lecture, we have discussed about Colithiasis, that is the gallstone. I believe you must all have gone through the book and you must all have seen the etiopathogenesis, the clinical features, the investigations, and the management, along with the homeopathic therapeutics of Colithiasis. Now, today we are going to start with another important topic, that is cholecystitis. Cholecystitis is basically inflammation of the gallbladder. Cholecystitis can present alone, or it can also present with the gallstone, that is Colithiasis. So cholecystitis is a very painful condition for which the patient will be coming to us, and it can present in two ways. It can be acute cholecystitis, or if it is remaining for a very long time, it can be chronic cholecystitis. So let's start with the cholecystitis. It is a very small topic, not a very big topic, but still the presentations and the symptoms are very important, because we will get a lot of patients with the cholecystitis, and cholecystitis is associated with many other diseases as well. So most of the cases of cholecystitis will be associated with the gallstone, that is Colithiasis, but few of them will be associated with other diseases of the or related to the other systems of the body. So in the last lecture, I have already told you the position of the gallbladder and the related structures. And I have also told you to go through the books and to see what is the anatomy, the functioning of the gallbladder. And I believe you must all have seen all those things. So let's start with the cholecystitis. Now, cholecystitis is the inflammation of the gallbladder. Itis is the inflammation, and cholecystitis means inflammation of the gallbladder. The inflammation of gallbladder can be because of the multiple causes, and there are a lot of factors that are responsible for the inflammation of the gallbladder. And based on the duration of the inflammation of the gallbladder, it can be acute or it can be chronic. So acute is of recent origin and the symptoms are very severe, whereas the chronic inflammation of the cholecystitis, it occurs, it is associated mostly with the gallstone, and it is occurring since a very long time. Chronic disease is a disease that is of very long onset. So let's start with the acute cholecystitis. Acute cholecystitis is the inflammation of the gallbladder. So in the inflammation, if there is inflammation of the gallbladder, it is known as, if there is acute inflammation, it is known as the acute cholecystitis. Now, what is the cause of acute inflammation? The acute inflammation of the gallbladder, it is caused mainly by the cystic duct obstruction by the impacted stone. So if we have already discussed about the gallstone in the last lecture, so I believe you must all have all know about the gallstone. So acute inflammation of the gallbladder is occurring due to the, or it is caused by the cystic duct obstruction. So if there is any cystic duct obstruction by the impacted stone, then it will lead to the cholecystitis. Now, what is the pathophysiology? The pathophysiology, that is the mechanism that is responsible for the development of the inflammatory process. The inflammatory process of the gallbladder is evoked by the following mechanism. By mechanical inflammation from the increased intraluminal pressure. So because of this stone, if there is any kind of mechanical inflammation that is causing, that is from the increased intraluminal pressure. The lumen means the space of the gallbladder. So if there is increased intraluminal pressure, that will produce mechanical inflammation that will lead to the development of the cholecystitis. The second condition is the chemical inflammation. Chemical inflammation can be there from the release of the lysolecithin. So if the lysolecithin is released, then it will produce chemical inflammation, and this will be leading to the development of the cholecystitis. And the third one is the bacterial inflammation. So inflammation can be from three different sources. One can be mechanical inflammation, the other can be chemical inflammation, and the third one can be the bacterial inflammation that can lead to development of cholecystitis. What are the three features? Mechanical inflammation, chemical, and the bacterial inflammation. Now, what are the clinical features? What are the clinical features with which the patient can present to us with the cases of cholecystitis? So we all know the signs of inflammation. There are 5 important signs of inflammation that will be present. We have Weber, tuber, dolor, Keller, and loss of function. So whenever inflammation is present, always think of those 5 points. Now, what are the specific features that are related to the gallstone or the gall inflammation, gallbladder inflammation, that is cholecystitis? So 90% of the cases that are presenting to us with cholecystitis are due to calculus, that is the stone in the gallbladder. We have already discussed in the Colithiasis that it can present with acute cholecystitis, it can present with chronic cholecystitis, it can present with the biliary colic. So depending upon the impaction of the stone. So acute cholecystitis can present along with the, this is present mostly with the stone, that is gallstone, in the 90% of the cases. 10% of the cases of cholecystitis can be acalculous. Acalculous means they can be present with any other presenting disease condition. The other disease condition includes parenteral nutrition. If a person is taking parenteral nutrition, then it can lead to the development of acute cholecystitis. There can be sickle cell disease. Sickle cell disease means if there is if the patient is having sickle cell anemia, then the patient can develop cholecystitis, or diabetes mellitus is sometimes associated with the development of the cholecystitis. So in the clinical features, 90% of the cases of cholecystitis that are coming to you will be due to the gallstone, that is calculus. 10% will be acalculous. Acalculous means they are associated without the presence of any kind of stone. And these are associated with the conditions like parenteral nutrition, sickle cell disease, and the diabetes mellitus. Now, what are the symptoms, signs and symptoms of acute cholecystitis? So there will be pain. We all know, we have already discussed in the gallstone that, or the Colithiasis, that there will be severe pain in the epigastrium and the right upper quadrant. And the pain will be radiating to the interscapular region or the tip of the right shoulder. So this we have already discussed. So because this condition is present along with the gallstone, so in the cholecystitis, the patient will be observing similar symptoms. Similar symptoms like pain in the right upper quadrant and in the epigastrium, and the pain radiating to the tip of the right shoulder and the interscapular region. Now, the pain will be prolonged because there are inflammation is present. So this pain will be prolonged. There will be a larger amount of pain that you are going to see. And the pain will be associated with fever and leukocytosis because inflammation is there. So there will be leukocytosis, there will be fever. The patient can present with pain in the epigastric region, in the right quadrant, right upper quadrant, the pain radiating to the tip of the right shoulder, interscapular region, and it is associated with fever and leukocytosis. So these are the clinical features which we are going to observe in case of acute cholecystitis. Let me just once again remind you all the symptoms. The cholecystitis is present with 90% with the calculus, that is the stone. 10% it is acalculous, that is present with the other features. Other features includes parenteral nutrition, sickle cell disease, and diabetes mellitus. The pain will be present in the epigastrium, that will be radiating to the tip of the right shoulder. Pain will also be in the right upper quadrant, and it will be also radiating to the interscapular region. The pain will be prolonged, excessive pain that is associated with fever and leukocytosis. Now, what are the investigations? What are the investigations that could be done in case of acute cholecystitis? So investigations remain the same as that of cholecystitis, with an addition of few other investigation. Because leukocytosis is present, we have just now discussed. So in the complete blood count, you are going to observe leukocytosis because inflammation is there. There will be increased in the transaminases and amylase level. So this was not present with the polylithiasis, but increased amylase and transaminase level will be seen with the cholecystitis. The plain X-ray of the abdomen and the chest may show radiopaque gallstone. So because it is most of the cases it is associated with the stone, so plain X-ray abdomen will show radiopaque gallstone. Ultrasonography, as it was done with the calculus cholecystitis, it is also done here with the cholecystitis, and it detects the gallstone and the gallbladder thickening. So there will be gallbladder thickening that you are going to observe in case of ultrasonography. And CT scan can be done to exclude the empyema and the perforation. So in the investigation, we will see leukocytosis. There will be increased amylase, amylase and transaminases. The plain X-ray abdomen will and the chest may show radiopaque gallstones. The ultrasonography will detect the gallstone and the gallbladder thickening, and CT can be done to exclude the empyema and the perforation. Now, how to manage a case of colithiasis? Whenever a patient of colithiasis is coming to us, how can we manage a case of colithiasis? In the management of colithiasis, we can ask the patient for the bed rest. So bed rest can be given because of the pain and inflammation that is present. You can ask the patient to rest properly, and pain relief, we can give analgesics. For the fever, we can give antibiotic. Antibiotics can be given for infection, and also maintenance of the fluid balance has to be done. So we have to give bed rest, proper bed rest, pain relief, antibiotics, and maintenance of the fluid balance. We can also go for non-steroidal anti-inflammatory drugs. So in the management, we can ask the patient to check for the non-steroidal anti-inflammatory drugs can be given to reduce the inflammation, pethidine for the pain relief. Cholecystitis usually resolved with the medical treatment. So if there is inflammation in the gallbladder, after the medical treatment, it gets easily resolved. And if there is a lot of pain, then urgent surgery is optimal treatment in case of cholecystectomy. Has to be done. So if there is severe pain, then the surgical removal of the gallbladder has to be done. But in most of the cases are usually managed with the bed rest, pain relief, antibiotics, and maintenance of the fluid balance with NSAIDs. So these medical treatment are usually resolving this complaint. But if the complaint is not resolved, then we have to go for the urgent surgery to remove the gallbladder, that is known as the cholecystectomy. Now, this was all about the acute cholecystitis. Next, we come to the condition of the chronic cholecystitis. What is chronic cholecystitis? Acute was the acute inflammation, chronic is the chronic inflammation. Cystitis, cholecystitis means the inflammation of the gallbladder. So in the chronic cholecystitis, there is chronic inflammation of the gallbladder, and it is associated with the gallstones. So there is chronic inflammation of the gallbladder that is mostly associated with the gallstones. The symptoms are those of recurrent attack of upper abdominal pain. So in the symptoms of chronic cholecystitis, there will be upper abdominal pain and at night and followed by a heavy meal. Chronic cholecystitis is usually occurring in the individuals when you are going to observe severe sudden pain at night. The patient has been sleeping after taking a heavy meal, and suddenly the patients wake up with a severe pain in the chest, severe pain in the epigastrium, in the right upper quadrant, the pain radiating to the tip of the right shoulder below the at the interscapular region. And this is because the food is not getting digested properly, and there is sudden severe pain that is occurring at the night. So in the chronic cholecystitis, the pain is usually occurring at night after a heavy meal. The clinical features are milder and are similar to that of the acute calculus cholecystitis that I have just told you. Pain in the epigastrium, right upper quadrant, pain radiating to the tip of the right shoulder, pain in the interscapular region. All these type of pain will be seen. And how to manage a case of chronic cholecystitis. So whenever a patient is coming to us with a severe pain, then we have to give analgesics. Analgesics are very important. The injections of analgesics have to be given, and along with it, antibiotics are given to reduce the bacterial load. And if the pain is very severe and if the pain is very recurrent, then we have to go for the surgery for the removal of the gallbladder, that is known as the cholecystectomy. So chronic cholecystitis, in chronic cholecystitis, the pains are very frequent. So the patient will have a lot of pains at night. Most of the time, the patient is experiencing this pain after a heavy meal. And the pain character we are already known, that epigastrium in the right upper quadrant radiating to the tip of the right scapula in the interscapular region. And this will be very severe type of pain, although the intensity can vary, but mostly it is of severe variety that has to be managed immediately. The patient is very much restless, and so the pain has to be managed immediately. So this is all about the cholecystitis. We have a lot of medicines for colithiasis and cholecystitis. So it's your homework to go through the materia medica, and you have to prepare your therapeutics on your own related to the cholecystitis and colithiasis. Some of the medicines includes, we have Barbaris vulgaris, we have Lycopodium, we have Chelidonium, we have Faltori. So these are some of the medicines that can be given in such cases. And the therapeutics you have to prepare, and you have to show me the therapeutics of every disease condition that we are going to discuss in these particular type of lectures. So I hope you must have understood this session properly. This session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you have understood the session properly. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all about acute cholecystitis. This was about chronic cholecystitis, and we have also discussed about the colithiasis. All these three things are related to each other, and you will get a lot of patients related to these conditions. So try to prepare the therapeutics for this disease condition, and because homeopathy offers a very good treatment in such cases. So try to manage the cases medicinally, and try to provide a lot of relief to the patient. So this was all for today. In the next lecture, we will be meeting with a new topic. So thank you very much. Have a good day.